At first, you might think it's a cold, and it could be, but COVID-19 could escalate. Here's what you need to know. According to the World Health Organization China Joint Mission on COVID-19, as of February 20th, 80% of laboratory confirmed cases were mild to moderate, 40% were severe, and 6% were critical. Just to be clear, a mild case of COVID-19 is not like a mild cold. Symptoms will still be pretty severe. Anything less than needing oxygen puts you in this category. Several cases do need supplemental oxygen, and critical ones are defined by respiratory or multi-organ failure. The symptoms of treatments and timelines of having the disease vary depending on which category patients fell into. So let's break down what having COVID-19 looks like day to day for each level of severity. It can take as few as 2 or as many as 14 days after being exposed to a novel coronavirus for the first symptom to develop. This is when it might feel like a cold or the common flu. Many patients develop fever early on. The World Health Organization China Joint Mission saw that about 88% of people who had COVID-19 had a fever. Another study out of China showed that while only 44% of patients had a fever on admission to a hospital, 98% eventually developed one. But there have been some cases that led gastrointestinal symptoms. Diarrhea, nausea, vomiting, and or abdominal discomfort may appear a couple of days before respiratory symptoms. This isn't the norm, because COVID-19 is respiratory disease. That means most patients, the virus will start and end with the lungs. In the early days of infection, the virus invades lung cells, especially this can damage the cilia, the hair-like projections that move around to keep airways clear or mucus, and they breathe. When cells get infected, they die and shut up, adding to the damage and hindering the body's ability to keep stuff out the lungs and trachea. The inflammatory causes damage, and damage causes more inflammation, and this cycle could continue until there's no healthy tissue left. And inflammation might explain why a dry cough is one of the most common symptoms. Same go for shortness of breath and plants. Production of symptoms that can appear around this time are fatigue, short throat, headache, joint or muscle pains, chills, and runny nose. But by day 5, patients with pre-existing condition might find that they have trouble with breathing, and usually takes about 7 days for a person to go to a hospital. Mild cases will usually clear up by this time, but those with moderate to critical cases will have developed pneumonia, which can range from non-life-threatening to severe. Recovery time for these patients could be anywhere from a few days to weeks. For some severe and critical cases, those symptoms can escalate into acute respiratory distress. Symptoms happen when fluid builds up in the lungs. Inflammation triggers a flood of immune cells that are meant to target the infection. They are usually isolated to infected areas, but sometimes the body goes overboard, which is when the immune cells start killing anything in their path, including healthy cells. As RDS is often fatal in critical cases, it can lead to respiratory failure requiring advanced life support, and this is most likely when patients head to the ICU. RDS treatment include supplemental oxygen and mechanical ventilation. The goal is to get more oxygen to bloodstream since the lungs can't. When this treatment doesn't work, the lungs work basically too flood to get any oxygen into the bloodstreams that cause almost COVID-19 deaths. And even when a patient survives this phase, they could be left with permanent lung damage, cells punched holes, and some infected person's lungs, giving them a honeycomb effect. And these lesions have been seen in people affected by the novel coronavirus. Two early studies found that most people who die of disease could do so within 40 to 19 days, and on an average, people who recover over released from the hospital after 2.5 weeks. But with the most critical cases, recovery could take months. Once a patient is in the recovery period, it's possible that they could still be contagious. These people should work with their doctors and public health officials to determine when they are no longer a risk. As of now, there is no vaccine for the virus, so the best way to avoid getting sick is to avoid being exposed. COVID-19 spread easily from person to person through coughing and sneezing. So wash your hands often and avoid close contact with people who are sick, and clean and disinfect surfaces that you use daily. COVID-19 should be taken seriously, but most cases are survivable. So stay home, stay clean, and don't panic. Thanks for watching.